Anna. It's so wonderful to finally get an opportunity to chat.
Nice to meet you
Why
again.
don't, yeah, wonderful. So why don't you introduce yourself to our viewers and let them know kind of, where you're working and how long you've been there.
Hello, my name is Anna Phan. I'm a new grad nurse. I graduated in June of 2024, and I'm currently working in a provincial correctional center as a registered nurse. And yeah, I've been working there since June, so it's been about 7 months now.
So it's been about 7 months.
Yeah.
So what's it been like?
I did my preceptorship there, so I had experience on that specific unit because I had been there for my 2 month full-time preceptorship. So I was already a little familiar, but now as a registered nurse, this is like when I'm more independent, when I'm doing my own assignments, and I still ask for help if needed, obviously, to provide the best patient care I can. But it has been really interesting to be independent as a nurse in corrections because in corrections we have like physicians on call or like we have our NPs who come in a couple days of the week, but otherwise we're pretty much on our own, making our own nursing decisions and then calling for the orders pretty much afterwards of the
Hmm.
fact. Yeah.
What's that like? That feels like heavy.
Yeah, definitely as a new grad, it's like overwhelming because there's some situations where I just have never encountered. I'm like, I don't know what the protocol is, or like I know what the protocol is in the hospital, but I don't know how it translates to the correctional setting. So that has been a little hard for me to navigate just because I don't have that hands-on experience yet compared to my coworkers who are like, they're like well into their career. They work in multiple units, they have ER experience, so they know what they're doing and they know what should happen, but I'm not quite there yet.
So walk us through what the last 6 months have been like for you.
I think in the beginning, it was a orientation kind of to the unit again because I did have a break from my preceptorship and the moment I got my new grad license. So I was getting back to the groove of working and like what my responsibilities were. And then after I had settled into the unit, I found that I was navigating a lot of feelings of sorry, I forget what it's called, but it's when imposter syndrome
Oh,
because
yeah,
I felt like
that sounds about right.
yeah, because like I was working with all these well-experienced nurses who knew what they were doing, and then I had these patients who were all older than me asking for help. And as someone who's younger, I have a lot of like respect for older people. So it was just a lot of navigating that kind of imposter syndrome of, oh, I don't know what I'm doing. I don't deserve to be here kind of idea. Yeah.
When did that start to change for you, where you started to feel like you belonged?
I would say it was actually pretty recent. There was an incident actually a couple weeks ago where we had this patient who was post-op from like I think a closed reduction surgery. So he had like these metal pins in his hand. And I remember I was checking in on him and like the pins were like loose. They were like coming out. And I was very concerned for him. And I called the on-call for orders because I didn't know what to do because I never had like surgery experience. My coworkers who are experienced nurses also don't know specifically anything about pins. So we called on-call and I remember he was very agitated, very frustrated. He found that my S bar wasn't accurate, wasn't sufficient. I didn't have all the details. And I remember he lashed out quite harshly at me. And it was actually a very emotional time because I started crying during shift. And prior to this, I've never like had any, I would say, emotional breakdowns about work. I've always been very, keeping work and life separate. But that was the first time where like I felt that he was calling me incompetent, and then it kind of balled up into like, oh, my imposter syndrome again, like, oh, I don't know what I'm doing. And it was just a big ordeal for me. But I think I really did grow from that experience because that made me realize like I have a lot of feelings about my competencies as a nurse and navigating imposter syndrome. And then I actually had a lot of support from my coworkers who were like, "No, you're a good nurse. You're just still learning. Like you can't get it all right from the start." And he was out of line too, so there was that. So from
So,
that moment, I started to change a little.
oh, that's interesting. So
Yeah.
how, when you say you started to change, how have you noticed you've changed since that interaction with that physician?
Well, I obviously didn't appreciate the tone and like how he went about his criticism, but I did like still take away like some feedback he gave me about my S bar. I was like, okay, yeah, I could have done it better. Did it warrant that type of reaction? No, but I could have done it better. I will admit that. So I like took it upon myself and I like sat down and like wrote. I basically just did my nursing notes of like basically when I was back in school doing notes on like how to do S bar and like just ways I can improve. And I asked like my coworkers for feedback after. And it's been a lot of like self growing and not being stagnant and not being like complacent, especially in the correctional setting where it's not high acuity, so you're not really pushed to grow. You're just like it's kind of like a long term care. That's what I like to compare it to.
That's an interesting comparison. I think that's
Yeah,
really accurate.
yeah,
Yeah. Maybe
yeah.
for the group, distinguish between corrections and forensics.
Oh, for us, so our my provincial correctional center houses inmates who have been served less than 2 years of sentence, or they're still waiting for their court dates. So this is like a jail. And they live on the units like of their own residence with their own officers. And then for us, we see them if they have medical concerns, and that's pretty much it. So we live in our own medical building, and they're brought down to us like based on a triage kind of basis of what concerns they have. And then
Okay.
we also have our own like little infirmary for people who like acutely need help or like monitoring. So that's us. Yeah.
Sure. Oh, yeah. So it's just basically ordinary people from the street
Yeah.
that end up in jail for whatever
Yeah.
reason. And then you attend to any emergencies that they might have or
Yeah.
help deal with any medical problems that they might have.
Yeah, and there's like a large variety. Like it's not like, oh, it's like post-op or it's medicine. Like it's a little bit of everything. Like you have diabetics, you have the high blood pressure, you have
Mm.
people with hernia, someone with an ostomy.
Sure, kind of everything.
Yeah.
Ah, absolutely. So you have to be a real generalist to do
Yeah.
environment. Yeah. What other
Hmm.
kinds of challenges do you find with corrections as a demographic of patient?
For the demographic of patients, I would say you do really have to be very mindful of the different identities that live in corrections. Like I find that a large portion of our population are drug users, and also there's a large portion who are indigenous. And I feel like you really have to individualize your care depending on who they are and be more mindful of it. And also be aware of like prejudice and biases that also exist, especially because it is the correction setting. And I find it's hard because sometimes us nurses, we can be a little prejudiced because, for example, if someone coming in to medical reporting pain, a lot of times the nurses will think they're drug seeking and like just asking for pain medication, which can be true because these people can be manipulative, hence why they're in jail. But at the same time, they do have real concerns of pain, and you can't be the one that differentiates is it real or is it not.
Oh,
So I find things like that are tough, especially for me. I like to believe, as a general thing, believe everybody, you know? I'm not here to judge. If anything, that's up to the physician. But it's kind of hard to navigate because you do see these manipulative tactics, and then you can sometimes see if they're being obvious that they're lying. about their pain or things like that. So that's one aspect of corrections I find difficult.
Yeah, I'd find that difficult too. Let's just go back for a second to that physician situation.
Go ahead.
Well, because I'm curious,
Mm,
um, what did you ever consider approaching that physician about his demeanor and about how his tone made you feel? Not and helping him to understand that you did take something away from the situation, but it didn't warrant that kind of affect.
mm. The thing about our physicians are we have the on-call physicians, which is the one I had called, and I've never met this man in my life. Like we only hear him through the phone, and it's like he alternates with other on-call physicians. So after that week, he's done until like whenever he's on call next. So then it's we don't meet them on a regular basis. So during that specific phone call, it was near the end of the shift, and by the time we had the orders in and I had everything done, the shift had already ended. We actually stayed past the end of the shift for that, but
What was
so
that? I
we
missed.
actually ended up staying past the end of the shift,
Ah,
like overtime. Because we're only open 16 hours. So after 11 o'clock, we're done.
okay.
Yeah. So for that specific day, I didn't have the opportunity to talk to him again about it since then. And all that has come out of it so far. I'm pretty sure I actually ended up putting my safety net in.
Good
Um,
for you.
yes, I
That was
had my CNE help me with that.
good. I'm glad to hear that.
Yeah, apparently he had also done the same thing to a different nurse a month prior. So they were noticing a pattern. So they highly encouraged me to put a safety net in if I was comfortable with it. And I said I was. So I haven't had the opportunity to talk to him, but that's all that has come out so far.
Yeah. Well, I'm glad that there was something that you felt comfortable doing. You know,
Mm-hmm.
we are responsible to help each other act in a way that's appropriate, right?
Mm,
And if it were the tables were turned and you were rude to the physician, I'm sure that you would hear about it.
I'm sure I would.
Yeah. So if you've got new graduates that are thinking, oh, I want to go into corrections, what advice do you have for the new graduate looking to go into corrections?
My advice, I mean, I highly encourage it if you don't enjoy a super acute setting, because like I said, you do every so often get the acute person who has like an infection and needs IV antibiotics, or someone who's like extremely nauseated or having DKA. But in general, they are not acute. This is more so like long-term care community, a little bit of mental health, addictions work. And I think if you're interested in those particular groups of people, like you're really into like addictions and mental health and working with like LGBTQ, I think this would be a great field for you. Some advice I would give is that, like I had mentioned before, you are very independent and you're expected to know a little bit of everything. So I would suggest going in with it with a little more experience than I had. I think it would just make the process smoother. Like for example, if you've already done med surge, if you've already done the emergency experience, then I think going to corrections would be great. You already know all your stuff, you know your skills, and then you can just go in and chill, basically. But there's not a lot of learning experiences in corrections if you're looking to learn. That's my thing.
So when you say learn, looking to grow as a professional and advance your practice skills over time,
Mhm.
it's not as much that.
Yeah, like I think our most hands-on like skill we do is probably like wound dressings and wound care. But otherwise, we're not doing IVs, we're not doing drains or anything like that. And if that's not your interest, then that's fine. It's just if that is something that you want to work on, just be aware that corrections probably isn't the place to do that.
So why don't you walk us through a day in the life of a corrections nurse? Like what do you do when you start at your shift and then till the end of your shift? Can you give us a sense of what that looks like?
I'll work through a typical day shift then. It's changed a little bit with Connect Care. I don't know if you heard, but Connect Care has really recently rolled out to like community and correctional settings. And it's changed a little bit of our day because beforehand we used a paper chart in like files,
Okay.
and but now we do all on the computer on Connect Care. So it's made our lives a little difficult because Connect Care wasn't really built for corrections, it was built for the hospital. But that's a different subject, so I'll just go through our day.
Conversation.
So we start at 6:45 a.m. I get in there, and the first thing I do is I'm starting to pour morning medications. So typically, depends on your assignment on what units. For example, if I'm on units 1 and 2, those are the girls, the female inmates, and then there's like units 5, 6, and 7, and then there's units 8 and 9, just like where they live in the prison, basically. So if I'm girls, I'm units 1 and 2, and I'm pouring meds. I think there's about 40 to 50 people on each unit who are on meds typically. So in the morning, 6:45 a.m., I'm pouring meds for about 100 people.
Right. Wow.
Yeah, all the way up until 8 a.m. Ideally, I'm done by 8 a.m. And then I go, an officer will drive me to the unit because the facility is quite large. And then I go into a little room with like a window, kind of like a takeout window, and
Okay.
the inmates line up. And then I ask for their name and their like patient identifier number. And once I verify who they are, I give them their meds. And then that goes on for about probably a good hour. I get back and then I double check my work on Connect Care, making sure everything looks right, all the meds were given, nothing was missed. And typically it'll flag me if anyone has any injections due today. And if I did have injections, I would let our medical officer know to bring them down later for me to give them their injections.
So
And
if
then,
you get an injection, they're brought to you, but if you're giving
mhm,
meds, go to them.
yes, correct.
And what if you need to do like vital signs or something like that? How do you deal with the window issue?
We would also do the same process where we give the names to the medical officer, and he'll have like a whole list of just everyone we need to bring down, like whether it's for vitals, for wound dressing, for its injection, and then he'll just go through and pick and choose what units to bring down in bulk.
I see.
Yeah.
Okay. Okay. And that would
Yeah.
I'm assuming that would happen after you've given your meds.
Yeah, usually it
Right.
happens in the afternoon. Once he
Oh,
has like a full list of like everyone that needs to come down.
sure. Okay, that makes
Yes.
so you get
Yeah.
back from your meds and you check your connect to see if you're on schedule
Yeah, yeah.
and then what happens?
And and then typically this kind of changes throughout the day depending on the correctional officer side, but typically we'll get admissions.
Okay.
So we'll get admissions from our remand center in the city. So the remand center is people like straight off the streets who just got arrested and like are waiting for court. And then they come to us after they've been sentenced, typically. So we get usually admissions like every weekday. So we go
Okay.
see them. I admit them into the facility. I medically clear them. And then if there's anything to flag, I flag it to the officers. And then after that, we come back to medic. Sorry, go ahead.
I ask you when you do admit someone, you do a full assessment and you look at all their medications
Mhm.
and then do you talk to a physician or do you just make the decision yourself that they're medically okay?
We typically make the decision ourselves.
Okay.
If they're like conditioned other than normal, like if you think they like took something or are mentally unstable, then you would consult like mental health about it and they would take it on from there. Yes.
Okay, got it.
Yeah.
Okay.
Yeah, we've had a couple people come in who are like suicidal and we're like, whoa, like you shouldn't have been moved. Like, why are you here? And we sometimes send them back to the remand center or we keep them like on mental health alerts, which is
Sure.
when we're doing like 30-minute checks on them.
Wow, that's pretty frequent.
Yeah.
And so that's quite intensive. So what do you do in those situations? You know, who takes over the other work that you have to do while you're doing every 30-minute checks?
The checks are actually on the officer's responsibility. So when they go to whatever unit, room, cell they're in, the officer will have a camera cell and they will have to physically do 30-minute checks. So it's not on the nurses.
Okay, okay, got
Yeah.
it. Got
Yeah.
it. And what
Teamwork.
else? Yeah, teamwork, exactly.
Yeah.
That's interdisciplinary collaboration
Yes.
in this setting.
Yes.
And
In
so,
this setting.
yeah, so then you come back and what's your next role?
Then after we see them and assess the new admissions, I'm typically charting and like going through their file, combing through like, okay, did they have any previously upcoming appointments at the remand center? And do I need to rebook them here for our center? Because those typically fall through the cracks. For
Mm,
example, because they can stay in the remand for a pretty long time. So they might have like a dentist appointment booked. So they have to rebook that for our dentist, if that
uh,
makes sense.
and do you have a dentist in the correction center?
He comes in, I think, every Thursday.
Oh, okay, well, that's
He
good.
typically sees like, I want to say 15 people per week.
Mm,
Yeah,
mm,
very interesting.
yeah. And so is there anything else in your day that keeps you busy?
So after that, it usually takes up all the way until lunch break. And then we take our lunch break with the officers because there's no point in us working if they can't bring down people and they're on break. So
Sure.
then we take about an hour break. And then at 1 o'clock, we start up again. And that's when the medical officer has a list and he brings everyone down, whoever needs vital signs, wound dressings,
Got it.
injections. And we're just filling up the rest of our shift with that basically.
Right. And do you work 8 or 12 hour shifts, Anna?
It's eights.
Yeah. And how do you like your rotation? Do you like 8 hour shifts?
I do enjoy 8 hour shifts. I'm currently in a point eight,
Okay.
but I do find a point eight a little brutal for 8 hour shifts.
Yeah.
It feels like I'm always working.
Yeah, I'll bet it does. How have you managed to maintain a work-life balance in this area of work?
Work-life balance, I found it all right with casual positions because as a casual, you can like make your own schedule basically, pick up when you want and not and have days off when you don't want to work. But with a point eight, it was like a wake up call for me. I was like, whoa, I have like no control over my schedule. And I'm like, I can't just cancel shifts willy-nilly. I have to have like sick bank, I have to have personal leave days, or I have to trade it away and make it work.
Hmm.
And I found having a work-life balance a little hard because I found that I was working like 4 or 5 days in a row and then having two off and then back at it again. And then I would fill up those 2 days with errands I needed done. And then I just have no time for anything else.
Yeah, that's
Eventually I got the hang of it, but
so you're in a rhythm now. You feel
I'm in
comfortable.
a rhythm now. Before I felt like I couldn't do anything before or after shift. That day was just work for me. But I found that unpractical of my life. So I sacrificed a little bit of sleep and I'm either doing stuff before shift or after shift to compensate.
Right.
Yeah.
Yeah, okay. Well, that makes sense.
Yeah.
Is there anything else that you had to engage in a major adjustment when you started out working?
Um, for me, I don't, my work is 40 minutes away from me.
Wow,
So
okay.
something I guess I had to accommodate for was for gas and mileage.
Yeah. And time
So, huh?
and
And
time
time, yes,
time
correct.
out of your day. It's almost like a
Yeah,
12-hour shift.
I know. So for new grads, I would highly recommend not working far away from your home.
Ah, well,
Yes.
it certainly does t put a ding into your timing when you
Yeah,
think
it does.
that, you're traveling and with traffic, it could be anywhere around 45 minutes, right?
Yes, yes,
Yeah,
yeah.
that's a tough one. I
I
hear
mean,
you.
if you really love your job, go ahead, but like it really does take a toll on you like mentally if you drive far every day.
I guess. Well, Anna, is there anything else you want to share with everyone about your experience working as a new grad in corrections?
I think one final message I would have is to not be scared of corrections. I feel like some people have this idea of like, oh, big, scary inmates who are ready to jump at you in corrections, but that's really not the case. These people here are serving their time and they just want medical care as if they were on the outside. And I think just into it with an open mind and a little bit of experience just to help you out. But if you don't got anything, that's fine. I did it. I'm doing it. And yeah, I don't know. I just hope everyone does what they like to as a new grad, and I hope they don't feel pressured to do anything they don't want to.
Right. Well, that was great, and so many insights. I know that if I were a new graduate and I was thinking, I don't know if I want to do that, I might be convinced that I can do it by
Yeah.
listening to you. So I love your idea about getting that additional med surge experience or something
Mhm.
that kind of puts that aside, so you don't have to worry so much about that, and you've got your skills up to
Mhm.
where you go in and are expected to know everything and function independently. So, yeah,
Yes.
I appreciate your thoughts, Anna, and thanks for sharing your experience with us.
Thanks for having me.